Hi, everybody in Forensic Psychology, Psych 267. This week we cover only one chapter, Forensic Psychological Evaluations. So let's get started. This is a little longer than some of the chapters. That's why we're only doing one this week. Hopefully you took the test and you're keeping up with the rest of the assignments. So first of all, why do an evaluation in a court setting? The reasons for that could be a number of things. I know it sounds more exciting to just think about serial killers and things like that. And yes, psychologists are involved with issues of that nature. However, in most cases, it's something different. A crime that's not quite that serious, or perhaps a divorce proceeding, or some kind of civil matter where somebody is suing over an injury. So that's why we get here to reasons for referral. Psychologists in most states do not prescribe medicine. I believe there's only 4 right now where they can. Arizona is not one of them. So instead, doing evaluations is a common thing that psychologists do. So here's what goes into one of those evaluations from court, whether it's criminal, child custody, accident injury, or otherwise. A reason for referral. The reader of your evaluation, almost like you're writing a paper for, let's say, an English class, has to know why you're writing the paper. Well, in this case, why are you doing the evaluation? Usually a paragraph or so, maybe about the person's history and if it was ordered by the court or whatever. Reason for referral. Then, observation. Number 2, you will be seeing this person. Even in COVID times, I still evaluate people in person. So what do I observe? Anything noteworthy? The fact that maybe you look like you're hearing voices or responding to something in your head, or you appear angry or agitated, or you can't stop laughing and really nothing is funny. Anything that's noticeable about your appearance or the way that you're acting. Observation. By the way, I once had a judge, when I did a training, said, I don't mean to be rude, but who cares if the person is tall, short, heavy, thin? And I said, well, I put that in my reports because what if the next time they are seen in court, the appearance is totally different? And I saw the judge shake her head like, oh, now I get it. If a person lost 50 pounds in a month, that doesn't sound like a Jenny Craig diet to me. It sounds like maybe they're using meth or cocaine or something. So see, your appearance can be part of the observation section, and it can be noteworthy. Background information. I spend a lot of time on this. Number 3, I want to know as much about the person's background as possible. Good and bad things, school, hospitalizations. Did you recently move? Were you diagnosed with something? Anything that's relevant to my report. Background information. Interviewing as many people as possible. Sometimes the person you're interviewing will lie. When I see juveniles for the court, sometimes it's their parents that lie to me, believe it or not. So the more people I can interview, the better. Record reviews. Records are only as good as the people who make the records, so the more records you can get, the better. Sometimes they're a little biased if it's from your favorite teacher or an interview with your mom or dad or something. The more records, the better. We've talked about this briefly before in a previous section, but younger people, there's more records than there are for older people because everything now is online or it's on a server somewhere. So the more records I can get about the person's background, the better. Now, here's the part that only psychologists can do, the testing. Intellectual and educational testing. Not only do I want to know if you're above average, or below average, I also want to know how that compares to your school-related skills. Can you do math? Can you read? Can you spell? Is it what I would expect considering your IQ? I put information in about all of that, assuming that the person is cooperating. Psychological testing. We talked about this in the previous section as well. projective and objective, also known as self-report. So I am trained to give people tests to see what kind of mental health issues they have. Now, are you thinking this like a lot of people would? What if the person just lies on the test? What if I say I have no drug problem? Well, guess what? I'm going to report that. You answered negatively, and I don't mean negative as bad, I mean negatively like, no, it's not a problem, on any drug or alcohol question. But you've been arrested 17 times and you've lost jobs for it too? Wow, I think you're lying. So the psychological test should line up with the record review and the interview information. It should all come together like pieces of a puzzle. I want to see what you're going to be admitting to and not. Projective testing is so interesting to me because people might lie on the self-report objective, and then you really get the truth from them, I should say, when you show them pictures or ask them to finish sentences. Their unconscious comes out. It's pretty amazing. So, moving right along. The primary purpose of testing is to see what types of patterns of thoughts, feelings, and actions the person will acknowledge. The second purpose is, are they being honest with you, honest and forthcoming about their issues? Now, this is a big part of the training to become a psychologist, and if you want to work in forensic areas, courtroom stuff, you really have to know how to use these tests for a few reasons. Not only do you want to be accurate in your reporting, but also it's quite common that attorneys will grill you on this in court, wanting to know how accurate the tests are and what they mean and why you picked one test over another. So you better learn this well if you want to work in forensic settings. The DSM diagnosis. Here's another thing that you don't learn unless you go to graduate school for psychology or psychiatry, or perhaps social work and counseling. The DSM diagnosis. What you want to do is diagnose people as accurately as possible based on everything that you've learned. The testing, the records, the interviews, and give the person a diagnosis. Also, that should lead into what needs to be done. If you have schizophrenia, is it okay for you to go home, or do you need more care than that? If you have, anxiety, should I recommend that you go see a medical doctor, psychiatrist perhaps, to get medicine? You have to have a reason for the diagnosis and then a plan for it too. Number 8 and 9 kind of go together, assessment of dangerousness. And number 9 is the likelihood of reoffending. I don't have a crystal ball. I can't predict the future, but I want to try to assess how dangerous the person is based on, especially for criminal cases, what behaviors have happened already. And to be honest with you, sometimes I'm kind of vague. If this has happened once, it could happen again. I put in phrases like that because I can't say for sure that he'll never do this again or she will never commit that type of crime in the future. I don't know. So I do my best with the information that I have. One thing that I look at, however, you'll see here in number 8, does the person admit it and take responsibility and seem to feel some remorse? Of course you can fake those things, but you can tell if the person was like, wow, I can't believe I did that. I feel so bad, compared to lying about it and blaming others. You want to see if you can assess whether this person has learned anything from it. So that is one thing that I look for. Likelihood of reoffending, again, is it part of a pattern? That's what I was getting at a minute ago. I always put that in there, that if it happened once, it could happen again. But certainly, if this person has done things like this repeatedly, from stealing cars to hurting people to setting fires or whatever, it could absolutely happen again. Summary, conclusions, recommendations. This could go by all of those names or just some of those names. You have to summarize your report and put forth a good recommendation. I just talked about an English class paper a little while ago on this recording. Well, here's another example. If you're writing a paper for English 102, you should have a good conclusion to it. And that's the same thing when you're writing a psych eval. So remember that English professor who said you're going to need this skill one day? Guess what? That person was right. If you're going to be a psychologist, you need those English skills. Tie up loose ends. See where I say that here? That's true for English papers and psychological evaluations. You want to make sure that you not only give a good recommendation, but that it all fits together. So if you talked about that the kid had a meltdown in the school cafeteria, well, I would mention it in the last section of the paper. The summary, recommendations, conclusions, whatever you call it. What does that mean? That he needs help in the cafeteria or he shouldn't go in there at all? That's an example of a real evaluation that I did. You need to bring it back, tie up the loose ends and say, here's why that's relevant and here's what needs to be done. Now, see this paragraph? Not all forensic evaluations are about criminals. I know my examples have been thus far in this video, but what about divorce and custody cases? What about accident injury cases? What about an evaluation to see if you should be a police officer who is on the SWAT team or something? It could be a lot of reasons for a psych eval. So, do you want to see an example of one? Go to Appendix A. Let me see if I can forward to that without completely making a fool of myself here. There it is. I was hoping I wouldn't keep you waiting for too long. This is an example of a real evaluation that I did several years ago, but I changed the person's name here so that, nobody would say, oh my goodness, I know that person. And you will see, maybe I didn't call it by exactly the same names as what we just went over, but it will be the same information and the same material. So, this video is a little more than 12 minutes. I thought maybe it would be like 15 minutes. I basically just hit the highlights, the summary. You definitely want to read through the chapter and make sure you're keeping up with the stuff from the Douglas book and preparing yourself for the exam. And you're going to be doing that complete 180 PowerPoint and a paper on your criminal. There's a lot of things to juggle in this class, but it shouldn't be difficult work, and it should be fun work, hopefully. That's it for now. See you on the next video.